It is widely known that it is challenging to enforce occupational health and safety in the construction industry, especially in developing countries. So my name is Risa Yosia Sunindio. Today we'll talk about these challenges in the context of Ghana, which represent a developing country. Currently, there is poor occupational health and safety enforcement in the construction industry in developing countries. So therefore, this research attempts to identify challenges confronting occupational health and safety enforcement institutions to carry out their enforcement mandates. And as I said earlier, the focus is in the construction industry in Ghana. So we collected data from people working in consultants, contractors, and in government institutions. And this is the result. There are 12 challenges faced by government institutions to enforce occupational health and safety in the construction industry. So the 12 challenges shown in this table has been ranked from 1 to 12, and the average scores are displayed here as well. So the scores can range from 1 to 5. 1 means strongly disagree and 5 means strongly agree. As you can see from the averages, many of them are actually quite high, meaning above 4. So those can be set as significant challenges. And even the remaining challenges, the average scores are relatively high as well. The majority are above 3.5. So we can say that these challenges, all of them, are relevant in the context of the construction industry in Ghana. So now let's see the top 4 challenges. The first key challenge is inadequate occupational health and safety regulations, standards, and policies. So an assessment carried out by the International Labour Organization identified that occupational health and safety laws in Ghana do not make enough provisions for key health and safety management systems. There is a lack of national occupational health and safety research program or institute with clear mandates and funding. And also, the current legislation does not deal with specific hazards or risks. A draft occupational policy developed as far back as the year 2000 is yet to be adopted. Consequently, inspectors, health and safety inspectors, are compelled to adopt regulations and standards from other countries in their enforcement duties. However, these adopted regulations and standards cannot be strictly enforced in Ghana because they do not have their roots or their sources from any occupational health and safety act in the country. So therefore, it is recommended that comprehensive occupational health and safety regulations, standards, and policies must be enacted to prioritize health and safety and provide for resources to be utilized in respect of implementing health and safety. The second one, lack of occupational health and safety campaigns and educations. So obviously campaigns and education is important to improve health and safety at workplaces. And unfortunately, they are virtually still non-existent in Ghana. So therefore, the enforcement institutions do not have consultations with employers, trade unions, and other stakeholders at the national level. And the lack of campaigns and education have been partly blamed for the general lack of awareness and knowledge of health and safety laws, and also for poor health and safety performance in Ghana. So therefore, it is recommended that enforcement institutions, so health and safety enforcement institutions, should adopt prevention-focused mass media campaigns at the population level, and also a more targeted campaign and education on construction sites. Now, the third challenge is about inadequate instances of sanctions and prosecutions for occupational health and safety breaches. So in this case, although health and safety offenses are criminal in nature, they have usually been treated otherwise. The lack of sanctions, including court-based prosecutions in respect of health and safety in Ghana, is a disincentive to enforcing health and safety regulations. Furthermore, the low levels of fines for occupational health and safety breaches has further, I guess, fueled the perception that breaches are not inherently criminal in Ghana. It is recommended that offending contractors are appropriately sanctioned and the specific breaches publicized. Then those contractors and other potential offending contractors can perceive the consequences of future breaches and take improved actions to comply with occupational health and safety requirements. The fourth challenge, the absence of occupational health and safety guidance materials. Globally, one of the important duties of health and safety enforcement institutions is the regular issuance of practical guidance materials, such as codes of practice, to guide organizations on how to comply with their legal duties under the applicable health and safety regulations. Unfortunately, poor health and safety knowledge pervades in developing countries, including in Ghana. And due to the lack of comprehensive occupational health and safety legislations in Ghana, the enforcement institutions have an important mandate to develop and disseminate guidelines relating to health and safety at workplaces. However, this practice is still absent at the moment. It is recommended that underpinned by adequate occupational health and safety regulations, standards, and policies, which is the first challenge here, health and safety guidance materials that are customized to suit the contextual needs in Ghana are progressively developed. Earlier, I said we collected data from consultants, contractors, and government institutions. So it's interesting to see here that they have different views concerning the challenges. The consultants and contractors, they tend to have the same view, but then for government institutions in these 7 challenges, their views are different from those of consultants and contractors. For challenges number 1 to number 4 and also number 7, the government institutions scored higher than consultants and contractors. So I guess they felt that these challenges are more real or more serious in the construction industry in Ghana. For consultants and contractors, it's interesting that they felt challenges number 5 and 6 are more serious in the workplace, and those 2 challenges are actually related with the responsibility of the government institution. So therefore, it's understandable why in these 2 challenges the government institutions scored lower than consultants and contractors. I guess the main point is that it's interesting to see the different perspectives. We need to dig deeper why they have different perspectives, and it's important as well to slowly align these perspectives to understand each other views on the challenges so they can work together to improve the enforcement practice in the construction industry in Ghana. So this research has been published in Construction Economics and Building, and the title is the same as the title of this presentation: Challenges for Occupational Health and Safety Enforcement in the Construction Industry in Ghana. This is part of the PhD research of Elijah Frimpong Boadu, who is the first author in this paper, and also the paper is also co-authored by Cynthia Jiangxing Wang in UNSW Built Environment. Thank you.